Thank you, Mr. President, and thank you, colleagues. Moment by moment. Typically in a natural disaster, crisis, we're looking at moment by moment decision making. And I think that's why so many Minnesotans are asking, do we need to continue peacetime powers for the governor? I understand it's a hot debate. I think that we could turn our attention to the public trust. And are we doing everything we can as 201 legislators and a governor to build that public trust? Because I think we talk about COVID exhaustion, we talk about noncompliance. We're a different state than we were 7 or 8 months ago, and some of that's by necessity, but some of it might not be necessary. Certainly, Senator Champion makes many very pertinent remarks regarding how this COVID-19 virus attacks people. And I'd like to once again say thank you to Senator Klein for the work that he does and the work that he and I have been able to do together. I'm not going to go through a litany of names and say, well, what was said in February and March and April and May, because I think we've all acknowledged that this is a fluid situation, changing monthly, if not weekly. I think that a few weeks ago, Dr. Mike Osterholm said the same thing. He said, folks, we have to be willing to recognize that what he had said in March might not be what he would say in July. And I certainly think that when Dr. Fauci and Dr. Redfield published their article in the New England Journal of Medicine in March, that indeed they would not want to be held to that in a fluid situation. So today I completed a death certificate this morning on one of my patients. I looked it over carefully because there's been so much attention given to death certificates. I'm absolutely convinced that the world in the arena in which physicians complete death certificates today is dramatically different than January of this year. There's more murkiness, there's more probable, there's more susceptible, there's more suspected. I was reading through some of my notes last night, and it's interesting to me that the World Health Organization put 2 different codes in place for COVID-19. U07.1, which is a confirmed test, a laboratory test, and U07.2. But in this country, we don't put laboratory results on death certificates. So the CDC has advised that the U07.2 code, which would typically be used for probable, suspected, more likely than not, that won't be used. So a probable will get recorded in the same way as a laboratory confirmed. That introduces an element of mushiness. So if I put down probable, it will go in as a U07.1, which is the same as if I had 3 different lab tests, each one confirming a COVID-19 case. That's the way we're doing death certificates. Within the last 3 weeks, there was a person who died on the highways of Minnesota in a motor vehicle accident. He was dead at the scene. But the paramedics and ambulance were forced to take that person to the ER so that they could have a COVID-19 test done. That's not the way we would normally do things. But this is where we're at today. I think what it speaks to is not a Republican position or a Democrat position. I think what it speaks to is that this is an odd position, and the public trust is being undermined. When we look at tests over the last 3 weeks, we've seen several breathtaking things. We had the New York Times of all sources report to us that because physicians are being given only a binary result, the PCR test is either positive or negative. We aren't aware, we're not being given any idea of what kind of viral load that patient may have had. We know that the PCR test can be cycled 10 times, 20 times, 30 times, 40 times. But typically when we're trying to diagnose viral illnesses, we cycle 30, 33, maybe 35. Epidemiologists and virologists and infectious disease people around the country have been surprised that the FDA has been willing to allow 37 to 40 cycles. If you do 30 cycles, you're in the billions. You've done 1 billion replications. If you go into 40 cycles, now you're into the trillions. And at that point in time, you could be picking up the smallest snippet of RNA that had been lying around the tissues of the lung or the pharynx or the sinuses. I don't think people realize how long mucus can hang around in our sinuses. So many people have said, these tests that we've been telling people they're positive PCR, they may have been, but they're not infectious now. They don't have enough of a viral load to transmit it if they wanted to spit on you. We also have seen that in terms of CDC COVID-19 deaths, 6% of the death certificates are isolated COVID-19 diagnoses. Now, that does not mean that the other 94% did not die of COVID-19. That's an absolute twisting of data, and I would not support that for a moment. But it does again introduce the murkiness that there's a lot of different diseases that may have been about to tip that person over into the realm of leaving this earth. We're not going to forget what we've done to the nursing home patients. That will be a legacy that will live with this legislature, this governor, for a long time to come. And it's not anybody's specific individual fault. But we will have to own the fact that we were, in terms of testing, placing a far higher priority on testing this group of people or this group of people. But we weren't testing the people that were working in the nursing homes, that were inspecting the nursing homes. The fact of the matter is, unfortunately, we've tested professional athletes before we would test nursing home inspectors. So we created a pipeline of active COVID-19 disease into our long-term care facilities. Many of our long-term care facility patients contracted the disease. And if that wasn't bad enough, then we told them, well, since you have the disease, we can't let you out. It felt like imprisonment. I had a call today about that specific matter. This person wants out. But if that wasn't bad enough, we went the next step, so that when someone's illness got worse and it appeared that they may not survive, they were told, you'll have to die alone. That's a legacy we'll all have to live with forever. A couple of years ago, when we were trying to complete the budget, Governor Walz put together, if you will, a tribunal. And there was a Speaker of the House, a Majority Leader of the Senate, and the Governor. Couldn't we entertain that for some of the decision-making that we're doing now? Couldn't we think of some way to share the responsibility and bring more discussion into play? Governor Walz is not making moment-to-moment decisions. Most of the decisions that are being made have been cogitated over extensively and frequently come as a result of days or weeks of thought and consideration. This is what we're about. In actuality, we're doing nothing more than trying to remind Governor Walz of what he said over and over again a couple of years ago. One Minnesota. One Minnesota. And the way you get one Minnesota is you build the public trust. That's been fractured. Thank you.